found that 3 feet in schools might be safe as long as there are masks. Dr. Walensky, are you revisiting the CDC guidance on this? And also, can you tell us where the 6 feet came from? Was that ever studied with masks?
Thank you for that question. Yes, we're looking at this carefully. The 6 feet data came from early studies with and without masks from respiratory viruses, flu viruses, as well as SARS and other coronaviruses, the MERS virus that Dr. Fauci just spoke about, and how how far aerosols and droplets can travel in that context. As soon as we put out our guidance, among the biggest challenges that we were aware of was the fact that schools were having a hard time with the 6 foot guidance. And that, of course, prompted more studies to say, is 6 feet necessary in the context of mask wearing? The study that you're remarking on is the first study that has been published that looked at 3 feet versus 6 feet. It was in Massachusetts schools where there was 100% mask wearing, and it demonstrated that students, when there was 100% mask wearing, had similar infection rates at 6 feet versus 3 feet, as well as staff had similar infections rate at 6 feet versus 6 feet when they were masked. We are looking at these data carefully. The question actually prompted more studies to be done, so we know more are forthcoming. We're taking all of those data carefully and revisiting our guidances in that context.
Great. Next question.
Next, we'll go to Shira Stein at Bloomberg.
Shira, you with us? Kevin, maybe we should take the next question and come back.
We'll come back to you, Shira. We'll go to Zeke at AP.
Thanks you all for doing the call. I was hoping you might be able to explain what your assessment is of the early rollout of the J&J vaccine. On the CDC tracker right now, it's showing under 1.3 million doses administered, with 3.7 million distributed, but obviously those doses have been distributed now for a couple of weeks. Are you seeing any hesitancy with the uptake in that shot versus the 2-dose regimes? Thank you.
Yep. Well, let's start this way. Let me ask Dr. Fauci, for people who haven't heard the review before, for you to talk about the Johnson & Johnson vaccine and how people should view it relative to the other two vaccines, the Moderna and Pfizer, and then I'll more specifically go into your question.
Yeah, thanks, Andy. Just to reiterate what we've said multiple times on these briefings, that we have 3 highly efficacious, safe vaccines that are now available to the American public. They have not been compared one to the other, which the only way you could effectively do that would be in head-to-head comparisons. So that's the reason why you'll hear all of us always say continuously is that the way to look at it is that there are 3 vaccines that are highly efficacious. If you go into a place and you have a certain vaccine available to you, take that vaccine rather than waiting for another vaccine, because all 3 of them are highly efficacious.
Yep, and let me address the other part of your question. So look, we watch this data, as you can imagine, incredibly closely. We don't have reason for concern at this point. To remind everybody, the Johnson & Johnson vaccine came out with it's no secret, a relatively small amount of doses. Given that, we know that states are metering how they're putting out the doses to be a little bit more straight line. And then third, that we are seeing it continue to ramp. There was a day this weekend where we saw 300,000 Johnson & Johnson doses. So I think it continues to climb. I think the key operative word in your question is early. By the time we get to the end of the month, I think we will see the ramp pattern where we expect it to be. Next question. Kevin,
Hi, thanks all.
Shira, you're there.
Yep,
Great.
there we go. Sorry about that earlier. Can you tell me why you decided to change the change the reimbursement number for the Medicare administration of vaccines? And then can you also talk, it looks like you're going to be doing some more public service announcements to promote vaccination. What's the budget for that?
Well, look, I think CMS, who focuses on making sure that our nation's seniors and our nation's people who live on low and fixed incomes are getting access to the same high-quality care that they deserve and that others in the country should get, determined that an additional level of reimbursement was going to increase vaccination rates, particularly in hard-to-reach communities. So asking people to do, as Dr. Fauci indicated, mobile vans, reach out into communities, and make the extra effort to meet people where they are to reimburse them. You know, we believe that the medical professionals that are on the front lines of this vaccination effort, by the way, the same people that are on the front lines of this entire pandemic need to be taken care of. And we think that's going to do a job of both increasing vaccinations as well as improving equity. And that's the reason behind it. Your second question was about education campaigns. Was that what it was?
Yep.
Yeah. So look, let me say this. Today, I think the latest data shows from I believe Pew that 69% of Americans are definitive in saying that they either have had a vaccine or plan to take a vaccine. That's significantly higher. It's at least 10 points higher than it was a short while ago, and more significant than when the Biden administration began. We think this is for a number of reasons. These are very good vaccines with an incredible track record, large clinical trials, years, as Dr. Fauci has indicated, of research into them. And many Americans got vaccinated early. And the people who I think have been watching this and seeing the process and seeing how it has had an impact on them and in their communities, they increasingly makes them want to take the vaccination. So we believe this is, in some respects, the easiest education effort ever, as if we let people see the truth and not get information on, say, Facebook or somewhere where there's less reliable information. People are capable of making these decisions for themselves. We know that people are not looking to be convinced by the government or by some other entity. They want to have conversations with people locally in their community, whether it's a doctor, their pharmacist, or other people that they trust. And our job, and I think the CDC has been doing a marvelous job at this, is to get reliable information out to people. These briefings are another example of this, very clear scientific information, the good and the bad. Now, we will be supporting that effort with all kinds of additional education efforts, including some paid efforts, including other types of conversations. But it's most important that the people who are the local trusted people continue to have the reliable information about these vaccines, and we believe that will continue the pattern that's already begun, which is that more and more people will be comfortable taking the vaccine. Kevin,
All
is
right.
that?
We're gonna squeeze one more question in from Brian Karam at the Bulwark.
Thanks. I'll be brief. I want to follow up on April Ryan's question about the number of people, the millions that have already been fully vaccinated. Today we heard that 30% of the adults or 20% of the seniors had received some vaccination. Is that are the 20% seniors at 20% of the total number, or is that a subset of all adults first? And secondly, if we use the number of shots that we are getting on a daily basis, the number of new cases, and the number of people who have been fully vaccinated, can you all, using those metrics, give us a better idea of when we'll either reach herd immunity or be in the clear, and thus when can we start sharing our dosage of vaccines with our allies and neighbors internationally?
It sounds like an SAT math question. So let me first clarify the basic of the numbers, because I think they may not have come through clearly. We are talking about close to 2/3 of seniors and close to 30% of all adults that have now received their first shot. And I think it's important for reasons that I think both Drs. Walensky and Fauci could articulate that people get their second shot, largely because of the durability and the variants. So as we report these numbers out, this is to report on the progress and the very hard work of tens of thousands of people, but it's by no means should be perceived as declaring victory. There's much more work to do. I think the question that you're asking in some sense is, when will we reach herd immunity? When will we have enough doses, et cetera? And what I would tell you is that, as the president articulated last week, we believe that we will have enough for the adult population produced by the end of May. And with some time after that, those vaccinations will have occurred. And it is with that that the president indicated that if we all do our part by the 4th of July, we should be able to take a really important step to bringing the things, the people, the events in our lives back into our lives. That's an if. That's really on all of us. So no matter what math you use, we will have enough vaccine doses. We do need people to actually get vaccinated. We do need everybody that's been doing this enormously important work to keep doing it. And if we do that, we should be in a position right around then when the adult population will have the vaccines they need. Now, if you're asking questions about our supply, we have indicated that there are other pieces of our supply that are important to us. And Dr. Fauci has mentioned this several times. Teenagers, adolescents, children, potential booster shots down the road, other things. So it's a very big equation with a lot of scenarios in it, and our job is to be prepared for every scenario. Now, having said all that, I think there was a part of your question about the world, about the globe, and so maybe I can ask Dr. Fauci to talk about the efforts that we have undertaken already, even as we vaccinate our country, to make sure we're playing a leadership role in the globe.
Yes, thank you, Andy. So as you well know, on the first day of the president's presidency, his tenure, he had me go out early in the morning and make a speech to the executive board of WHO saying we're going to rejoin WHO and we're going to be part of COVAX, which means, that we've made a commitment of $4 billion that the United States will be giving to COVAX, which is a multi-organization, multi-country effort to help those countries that do not have the resources to be able to vaccinate their people to get them vaccinated. In addition, it's become clear that after we get our people in the United States vaccinated, and remember, we've suffered terribly with over 530,000 deaths thus far. So our responsibility of getting our people vaccinated first before we start giving doses to other countries, which we will be doing that if and when we do have a surplus, which it looks very much like we will. But that will not occur until we actually have our people vaccinated. But the $4 billion has already been implemented. Part of it, $2 billion, and then $2 billion to come. So we're very actively involved in thinking about and caring about the plight of other countries. Andy, if I might just make one comment that was made part of the question, we should not get so fixated on this elusive number of herd immunity. We should just be concerned about getting as many people vaccinated as quickly as we possibly can, because herd immunity is still somewhat of an elusive number. We made a projection of it would likely be, I've said many times, somewhere between 70 and 85%, but we don't know that for sure. So rather than fixating on that, why don't we just say, get as many people vaccinated as quickly as you possibly can, and every day that goes by now with more than 2 million doses going into people, we're getting closer and closer to control of this pandemic. Thanks, Andy.
Great, thank you. And thank you all for listening in. And I really want to thank again the doctors, nurses, physicians, vaccinators, people around the country who've been and are continuing to be part of this extraordinary effort that we need to keep going. We will be here Wednesday to do this once again. Thank you.